Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing topics of importance to local residents. Today we are broadcasting from the new Brunswick Novant Medical Center, which is set to open July 31st. We have a very special guest today, Mr. Shelbourn Stevens, the Senior Director of Operations for the hospital. He will share important information regarding the move from Brunswick Community Hospital to Brunswick Novant Medical Center. Stay tuned to learn more about the new hospital and the upcoming move with Health Watch. Shelbourn, thank you so much for joining us today.
Thanks for having me.
You're welcome. Before we begin to talk about the move of the new hospital, tell me a little bit about yourself and what you do at Brunswick Community Hospital.
Well, my title is the Senior Director of Operations, and what that means in a nutshell is I'm responsible for the day-to-day operations and everything that happens at Brunswick Community Hospital. That also includes what happens in our ambulatory market, our surgery centers and imaging centers.
Mm-hmm. Wow. Sounds like a busy job.
It is a busy job, but it's fun.
I'm sure it is, especially today.
It is.
How long have you been at Brunswick Community Hospital?
Soon be 5 years.
Mm-hmm.
I came a few months after Novant bought and took over Brunswick Community Hospital.
Mm-hmm. It's been 5 years already.
It has. It's amazing, isn't it?
Yeah. Well, I understand that you've been with Novant much longer. Is that correct?
It is. This is my 21st year with the company.
Wow.
Yeah.
That is a long time.
It is.
So you came here from another market?
I did. I came from Forsyth Medical Center in Winston-Salem.
Mm-hmm.
I have a clinical background. Years ago, I was a respiratory therapist for many years, and then started managing respiratory therapy departments in the Winston market, and then took over pulmonary services and cardiac services, and then came down here.
To the beach.
To the beach.
Well, I know it must be a very exciting time at the hospital, not to mention busy.
It is busy, but it is very, very exciting.
Well, tell me how you and your staff are preparing for this move that's coming up.
We've been preparing for a long time, and we've been having lots of planning sessions, talking about which departments are moving when, planning education sessions, planning new equipment, what equipment's moving with us. So we've been working on this for well over a year now.
Over a year.
Mm-hmm.
Mm-hmm.
So lots of meetings, lots of planning sessions with staff, physicians, and so it's been a long process, but it's been fun.
Well, it sounds like the staff is going through some extensive training to move into the facility, correct?
They are. There are some new equipment that they have to get trained on, and all that training has begun. Just learning the facility and tours that are happening, and just planning how the move is going to take place and what departments are moving when and that kind of stuff. So it's been extensive training, and at the same time we've been running a hospital and taking care of our current patients.
I'm sure that's been quite a job.
It is.
I assume that there's a company that's helping with this move. Talk a little bit about that company and how they were chosen.
Healthcare Relocations is the name of the company, and they're nationally known. They've moved over 250 healthcare industries, including hospitals and labs. The reason we chose them over the other companies that we interviewed is they were the only company that the first words out of their mouth were patient-focused. And we were sold right then. And during the entire planning process, they've always been focused on a safe move for our patients. Worrying about equipment comes second and third, but worried about our patients comes first. And they've moved major institutions like UCLA Medical Center and Johns Hopkins.
Wow, and that's no easy feat.
It is not. It is not. So we've been working with them for well over a year. They've helped plan our departmental moves, our equipment moves. They have detailed plans with each department. They've met with staff and physicians, and lots of details have gone into it, and they've left no stone unturned, and making sure our staff understand all the processes and exactly which department's moving at what time and when patients will start moving. We've been very impressed with this company. So we're very excited, and we're ready to go.
We previously had Angelo Williams on the show, and he did speak about the company and how safety was uppermost in their minds. I know you briefly mentioned that you had been working with them about a year. Could you tell me a little bit more about what that entailed?
Yes, they've been coming down every few months and having meetings with physicians and staff and helping us plan the details like I mentioned before. We're done with that, and we've done a tabletop patient move and department move process so far. All of that went very smoothly. We've walked the entire new facility and planned which entrances we'll use for patients and how the traffic is going to flow. They'll be back in July. And they'll be hiring some local people to help them on their end, and we'll have cleaning crews to clean equipment as it comes out. We will have lift teams to help lift patients onto stretchers or get them into wheelchairs, and we'll have what we call porter teams that will transport patients. And so there'll be different teams along the way for the move to help move not only patients but equipment from Brunswick Community Hospital to the new facility, and they've done an excellent job coordinating all of that, and I have no doubt that whole process is going to go very smoothly. Again, the focus has been on our patients and how we're going to have a safe, comfortable move for the patients from the old facility to the new facility.
Mm-hmm. Well, let's focus a little bit more on logistics. Now, I understand that the move is scheduled for Sunday, July 31st. Is that correct?
That is correct. That's the day for patient moves.
Mm-hmm.
A lot of departments will start moving that week before. That's part of the plan. A lot of the clinical departments have several phases, so we'll move offices first, and then equipment that we don't need right away, we'll begin to move that. Most of our lab equipment, we have 2 of everything just for backup and emergencies. So we'll start moving some of the backup equipment. And depending on our patient census, we may move some beds. We bought all new beds in the last year, so we'll bring those new beds with us. But all that really depends on the census that we have. And then on Sunday morning, that's when we'll start our patient move to the new hospital.
Well, I'm curious, how did the leaders of the hospital decide on a Sunday to move the patients?
That wasn't an easy decision. It took a lot of thought. We looked at our census that we normally run, which day of the week, what times of day. We looked at the emergency room visits, which days are the busiest and which times of day are the slowest, and looked at the traffic patterns in the county. And Sunday turned out to be the slowest day of the week on the traffic out front, and it was also the slowest time for the emergency department, and usually our census had dropped on Sunday. So that's how we came upon doing it on Sunday morning.
Well, that makes sense now.
Yeah. Hopefully all the vacationers will sleep in.
Yeah, really. Well, if you could, walk me through what that day will look like, a step by step. How does that happen beginning on Sunday morning?
Again, on patient move day, we'll start really early. The ED at the current facility will close at 6 a.m. That means patients that are there, we're going to treat those patients there at that facility. So if you show up at 5:50 a.m. and you need service, we're going to be there for you. But if you need health care after 6 a.m. or you have a cut or minor emergency or any emergency, the new ER will open at 6 a.m. and that traffic pattern will be open then. Then around 7 a.m. or when we think we're ready, we will begin the patient move. Depending on our patient census, it may take us a couple hours, it may take us 4 hours, it may take us 6 hours. Again, we're going to focus on patient safety. So we're going to focus individually on each patient and making sure each patient is packed up and they're traveled safely to the new facility and into their new room, and they're very comfortable the whole way.
Not knowing how many patients you have, can you estimate how long that move will take on that Sunday morning?
If we went with today's current census, we think that the patients would have breakfast at the old facility and lunch at the new facility. It's a pretty quick process, and like I said, Healthcare Relocations has really helped us plan this patient move, and they've done hundreds of hospitals, so they're the experts, and we relied on them heavily to help us walk through what that process will look like. And in our practice run, it was a pretty seamless move.
You had a practice run?
We did. We had a tabletop exercise, and then we had a local EMS truck there, and we put one of our employees on a stretcher, took them through the hospital. We all walked through the process, loaded loaded them up on the EMS truck and brought them to the new facility and took them up to a patient room. So we all got to walk through that exercise to see what the patient experience is going to be like and how we could make it more pleasurable for the patient. Even though they're sick, we want it to be a smooth transition.
So you said that the emergency room in the old facility would close at 6 a.m. And then in the new facility it would open at 6 a.m.
Correct.
So what does that mean, that you'll have staff and physicians at both facilities at the same time?
We will have to, yes. If patients are in our old ED right at 6 a.m., we're going to treat them there. If you're there for minor things, you know, just needed sutures, we're going to go ahead and treat you even if it's 6:30 a.m. and you were there prior to 6.
Right.
We're going to treat you and discharge you from that emergency department.
Yeah, because you could have been like waiting in the waiting area.
You could have. You're exactly right. If you were there and you're really sick and you need to be admitted, then you just become part of the patient move process.
I see.
So that we've planned on being able to add several patients to that move process. That will not be a problem at all.
And then I would assume once you've finished seeing all the patients that were already there at the old facility, then that would be the end of it there, and they would be coming to the new facility.
They would. Hopefully, once all the patients are out of Brunswick Community Hospital, we'll begin what we call a final sweep, and that's getting the last of the equipment out that we need. However, if you did show up at the new facility...
Yeah, I was going to ask that. What happens if somebody just shows up at the old facility?
If you show up at the new facility, we're going to get you health care if you need it. If you're there for something minor, we'll have the local police out front directing traffic towards the new facility. But if you are very sick and need help immediately, we will have an extra county EMS truck there available to treat you and get you safely to our new emergency department. Because there will be some people who might forget today was patient move day and they turn in the driveway of the new facility, but we will have people there at our entrance to take care of you.
So at the entrance on 17 there would be somebody there to let the folks know that, that they've recently moved.
That's exactly right.
And direct them on up the road.
That's exactly right.
Good.
We're going to take care of everybody.
That sounds like you won't miss anyone then.
You got it.
Yeah, that makes sense. And you said that there will be patients moved from the old facility to the new facility. What types of vehicles will you be using for this?
Mostly local EMS, and we have another Ameritech company that we're using for their trucks. They have wheelchair van accessible for patients who could go via wheelchair and they don't have to go on a stretcher.
Oh, I see.
But we have all of those. We're going to have 10 total trucks that will be available to take folks to the new place. If you can go in a wheelchair, that's the way we're going to take you, but if you need a stretcher, then you'll go into a local EMS truck. And if we happen to have critically ill patients, each one of them would go on their own individualized truck with a nurse and local EMS to bring them to the new facility.
I was going to ask that if there will be clinical personnel on the trucks or on the
there will be
ambulances with our patients.
Yeah, depending on the level of care that you need, we'll have the appropriate care there. If it's a BLS, basic life support trained person, or if it needs to be an RN on that vehicle, just like we would take care of you in our hospital, we're going to provide the same level of care.
Well, during the move, would there be a need to transfer patients to another facility as a result of the move?
If they're currently admitted, there shouldn't be. We do transfer patients for a higher level of care if they need that, if it was a trauma or something like that. So if a trauma came in that day to our ED, you know, we may have to transfer somebody to another facility, or if someone became sicker that needed a higher level of care, we may, but we don't anticipate that. If they're admitted that day, our plan is that they'll transition with us to the new facility.
Oh, well, that's good to know. Now, Shelbourn, will the entire move take place on this day? I know you said that patients will move that day. Talk to me a little bit about what will precede that one day.
Yeah, the move actually starts the weekend before. And there'll be a lot of behind the scenes. So we'll move some offices, our HR services, et cetera. There'll be some of the first departments to move. Then, starting on Monday, we'll start moving some of the clinical departments. And they have multiple phases that are very detailed out as to which piece of equipment is moving with them on what day and what time.
What time?
Exactly. We hope that we'll stick to those times. It's very fluid. But a lot of our existing equipment, like all of our lab equipment, we've replaced in the last 5 years since we've been here. So all of that's new, and it's coming with us. So we're relying on the vendors who made that equipment to come move it for us. And they know how to properly set it up. And then there's some testing that needs to be done to make sure that they're running accurately. But each area has phases of the move. And during the week, each day, there's another phase as stuff begins to come on over. And as I said earlier, depending on our census, we may start moving some of the patient care beds over. But we're adding beds here to this facility. So we will have some beds already here that are up in the patient rooms today that we can start our move with.
Wow, that's a whole week. I can't imagine that.
It is very extensive, but I think we're pacing ourselves to where we're going to be able to very safely take care of our patients at the current facility. We're going to be able to safely move them to the new facility and then care for those new patients that come to the new facility.
That's good. Good to know. What about services? Will there be any change in services during the time of the move?
There should be very few changes to services. There will be a few ancillary services because we have some equipment moving. One that comes to mind is mammography. We recently, in the last couple of years, put in digital mammography, and that's new equipment. So it takes several days to take that equipment down and move it to the new facility. But those aren't emergent or urgent situations. So, and most people, as they call now to schedule those, they're saying, oh, I'm going to wait to the new hospital. So that's a service that will be limited that week. We probably won't be available the week of the move, but on Monday morning, August 1st, it'll be up and ready.
What about surgery? What about the ORs, things like that?
That's a major milestone. On Tuesday that week of the hospital move, the hospital will go down to 2 ORs. We will stop all elective cases, which means you just decide you want to get something done this week versus waiting till next month. We won't schedule those. We're really only going to do urgent and emergent cases after that. So that way we can go ahead and supply and stock 2 of our 4 ORs at the new facility and have them ready for Sunday if we do have a patient come in and need emergency surgery on Sunday.
Well, that's good to know. Well, what about services at the new hospital? Will all the services be up and running on opening day, July 31st?
They will be. Again, that'll be patient move day, so a lot of outpatient testing. It'll be ready to go. A lot of people, though, will probably wait till Monday to get a lot of those scheduled. But again, if somebody comes into our emergency department and needs a CT scan or something, all of those services will be available. Our OR will be available for emergency cases. And on Monday morning, it would be just like we've been here for months already. Everything will be up and open. The only service at the new facility that will be limited will be our cafeteria. And it'll only be limited to our staff and visitors. We're really going to be focusing on the patients during that move, and we want to make sure that they have a hot meal and they're getting what they need. The cafeteria will be open, but it'll be with limited items. So there'll probably be sandwiches and salads available, but it won't be fully functional quite yet. We're hoping to do that later on in the week.
Well, as long as our patients are having good hot meals, I think that'll be fine, and the visitors will understand.
Yeah, they will.
And speaking of visitors, will there be any restriction of visitation during this move?
Again, our focus is on our patients, so we will be sharing with patients' families and guests that we want to limit the visitation during the day of the move. So prior to that move, we'll be planning all week which patient's going to move to which room, and we'll be giving information to family members and visitors prior to the move about this is the room that we think they're going to, and this is the telephone number to the new nursing station. We're really going to ask that they not come on the new campus until after 3 p.m. That way we don't have any interruptions or a lot of traffic with getting in front of the vehicles bringing the patients over. But they'll have a phone number and they can call, and we plan to get a contact number for a primary source for that patient. So once the patient is at the hospital, we'll call and say that your loved one's been moved over, they're safely here, and they are in this room number that we thought they were going in, and remind them this is the number if you want to call and talk to them on the telephone. And again, we want to wait till about 3 p.m. before people come to visit. Hopefully, if everything goes smoothly and we're done by lunchtime and people do happen to come a little early, we might let them in. But we really ask about after 3 p.m. just so that we don't have any interruptions.
Well, that sounds reasonable. And I'm sure that visitors will understand that, you know, it's quite an ordeal to move that many patients. So. And
they're going to want our focus on their loved one that we're trying to take care of and make sure they're safe and in their new room.
Yeah. And I've heard you mention safety many, many times during this conversation. In what ways are you and the team ensuring the safety of those patients?
Again, one of them was that mock patient move that we did with our staff so they could sort of see and understand the flow. We have weekly huddles with our leaders where we talk about big items that have come up, what's concerning them around the move. We're trying to lower the anxiety level, and really and truly, there's not a lot of anxiety around the move. All the managers feel well prepared. They've been having staff meetings, going over plans with their staff. Staff are getting trained on equipment in the new facility. So that's what we talk about, is what worries you as a staff member for us moving our patients safely. And then we talk about those concerns and make sure that we have fixes in place so that we don't have any issues occur.
Well, that's a lot of information about the move, and I'd kind of like to switch gears right now. If we could simply talk about some of the special features of the new facility. What are you most excited about in regards to the new facility?
It's big. We have space. The current facility, it is very small. We have small patient rooms. We still have semi-private rooms. Here, it's all private patient rooms. There's no more sharing of rooms. They're large. There's day beds in every room for guests. There's a recliner for the patients. There's flat screen TVs. Each room has its own bathroom and shower. There's no more hallway shower any longer. And with space comes anxiety of wayfinding and trying to figure out where to go and how to find your way around. But we've added a lot of features, and there's a lot of signage, and we have guest services people who'll be at the front desk to sort of guide you and help you find your way around and be able to locate where your loved ones are. But again, the current hospital is one story. We have elevators at the new place. This is 4 stories. So again, just space is the biggest change. And for our staff, that's probably been the biggest worry, is finding their way around. The current hospital is about 70,000 square feet, and this new hospital is 250,000 square feet. A few other added features is our emergency department. If you've been today, it's very small. There's only 9 rooms with 3 other bays with recliners. The new emergency department has 22 rooms in it. They're all private. There's breakaway doors with curtains, a lot more space for the staff, a lot more privacy for the patients. In our ambulatory surgery unit today, they have 6 bays to pre-op patients in. When we move into the new facility, is 20 private rooms with a bathroom that they can do their pre-op work in, and you're not surrounded by a curtain where you can hear the person next door. And again, at the new facility, we have 4 ORs. At our current facility, we have 3. And we'll have our C-section room at the new facility, but it'll be up on the floor with mother baby, so that's going to be much more convenient.
Oh, that will be convenient.
And very nice. So we're very, very excited.
And how many beds, again, do you have at the old facility?
We have 60 beds at the old facility, and we'll be going to 74 patient beds at the new hospital with an additional 4 observation beds. So you may hear people say 78 beds.
Yeah, I've heard that.
But there's really 74 licensed beds with 4 observation beds. And a lot of times patients are admitted as an observation status versus an inpatient, and that's how those will be utilized.
Generally speaking, how will the hospital be laid out?
Well, most everyone will enter on the first floor, and that's
Okay.
how you will get into your outpatient areas. You'll come into the main entrance, and that's where patient registration is, and you'll register to have radiology procedures done, or even for your outpatient surgery. The emergency department is located on the first floor. If you need lab work done, that's all done on the first floor. It's right as you come into the front door. So it's conveniently laid out. What the best part is, if you've been in our radiology department today, it's all very tight and close-knit. You only have to walk a few feet. It's much, much larger in the new facility. So there's a lot more room for privacy, and we have a lot of space to be able to do our test and give you the privacy that you need.
Well, it sounds real convenient having all those ancillary services right on the first floor.
It is. It is. The patients will just have to come in that one way, and we'll help them find their way around so they get used to it. But it's sort of a seamless process. On the ground floor will be most of the support areas, such as engineering, our environmental services, and everything. The second floor of the hospital is 50 beds of med-surg, and med-surg is where the majority of our patients go to.
That's almost as big as the old facility.
It is.
Just that one floor.
On the one floor, but it's very, very large. Those hallways are very long, but it's 50, again, private rooms, no more semi-private rooms. Physical therapy is located right there on that floor, so it's convenient. Pharmacy is also located there, so it's very convenient for those nurses. The third floor is where maternity is, and those rooms are very impressive. Today, at the old hospital, we only have two what we call LDRPs, which are your labor rooms. And then once you've had your baby in the LDRP, you go to a regular room.
Right.
At the new facility, they're all LDRPs. So you come in, you labor.
So the entire process happens in one room?
It's in one room. You
that's
labor,
great.
have your baby, everything. You're just in that one room. It's yours until you go home. So also up on the third floor is our sort of a step-down unit. We call it progressive care, or PCU. That unit has increased from 8 beds to 14. And then we have our 5 ICU beds that are up on the third floor as well.
I cannot wait. And I'm sure the county can't wait either.
We're ready. We're ready to move. It's exciting.
Well, what about the equipment in the new facility? Is most of it brand new?
There's a lot of new equipment. Most everything in radiology is new. We have a new MRI scanner that's in there.
Oh, wow.
The nice thing about it is people get worried about being put in a tube.
Right.
It looks like a casket.
I'm one of them.
Me too. This one is more like a CT scanner. So you can have your abdomen, have an MRI of your abdomen, and your feet and head are sticking out of the MRI. So,
Well, that'll help.
yeah, and we can take larger patients. Today we have an issue with the heavier population that our table and MRI and CT won't hold them. So our new scanners will go up to 500 pounds to hold those patients. So that's going to be an added feature.
That's a big change.
It is. That's an added plus. Again, the lab equipment, like I said, we've replaced the majority of it in the last couple of years, so it will move with us. But in the ORs, there's all new lights, new video equipment. There's all new telemetry throughout the building. That's all modern technology. So the majority of the equipment, furniture, everything in the building is new. So we're very excited.
Well, how about the visiting hours? Are they going to be different in the new facility?
We have open visiting hours, basically, which means you can visit anytime you want. We do have a higher level of security at this new facility, so the front doors will lock around 10 p.m. at night. But that doesn't mean you can't get in the building. If you need to get in the building after 10, you can come in through the emergency department. We'll have people there to help you find your way up to your loved one's room. And if you need to leave the building, it's after 10, there's a side door at the front where you can get out. But there's a lot of security in the building. There's over 80-some cameras throughout the parking lots in the building that's added protection. And we have one room that has a security tech in it who monitors all of those video equipment.
Sounds like a really safe facility.
It is. So any emergency that goes on, we're going to see it right away, and we're going to dispatch help to that area.
Shelbourn, before we wrap up, I understand there are a few events coming up. Can you tell us a little bit more about those?
Sure. We have 2 events coming up in July. The first one is on July 14th, and that's our Brunswick Novant Medical Center Foundation Gala. And there'll be tickets available for that if people would like to attend. They can call the current facility to get more information about that. But that's going to be a fun night, sort of a premiere Hollywood night. The second one will be on Saturday the 16th, and we'll start at 1 p.m. with a ribbon cutting, and then that'll be open to the public, and we'll have tours of the facility that afternoon for all that come. So we're very excited.
That sounds like a lot of fun. I'm really looking forward to that.
We are too.
Well, thank you so much for being here today. It's been such a pleasure, and we've learned so much, and we're all looking forward to opening that brand new facility.
Thank you, and we are too.
Thank you for tuning in to ATMC-TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmc-tv@atmc.coop. I would also like to encourage you to participate in Novant's Focus on Health seminars. These seminars are held on the third Thursday of each month in the Brunswick Electric Community Room. During these seminars, local medical professionals discuss health topics of interest and answer your specific questions. Please check the local newspapers for additional information or visit brunswickcommunityhospital.org. Thank you again for joining us. Be sure to join us next time for Health Watch on ATMC-TV.